I want to start first with one key issue that we've talked about for many years, HIV and AIDS. What changes have you seen in terms of the epidemic, and what work do you think needs to continue so that we can combat that problem?
Well, more people are becoming aware of the incidence of this pandemic, and they're not taking it for granted anymore that like it used to be. Now that we've been spreading the word about stigma and also about HIV itself not being the end of life, it's like any chronic disease. People are coming out of the closet and going out to test and actually, talking about it, disclosing to their partners. In parts of the country like sub-Saharan Africa and South Africa and a few other places, there still needs a lot of work to be done to make sure that people are not stigmatized, because stigma itself can kill. And that's the core of the problem. People don't want to disclose, they don't want to be seen, they don't want to, go for tests, they don't want to seek care because of how other people look at anybody that is going through or has HIV/AIDS.
Do you think that somewhere along the lines, miseducation or misunderstanding about,
Misinformation.
yeah,
In fact, the mode of transmission of HIV is a lot of people have misconceptions. I know from the part of the world I come from, and some parts of East Africa, some people believe that it has to do with witchcraft. And some people do believe that it's a punishment from God, even in the faith-based organizations, community. And as long as these misconceptions are not addressed and the actual facts put out there, we will still have problems. And that's one of the main thrusts of the problems that we're having in Africa. And as you know, in some African countries, for example, I keep talking about Africa because I'm an African. And most times, sex, any diseases that has to do with sex or sexual diseases, there's a culture of silence on discussions about it, which is ingrained in our culture. So that alone is another factor.
speaking of problems, we talked about HIV/AIDS. What else do you see as another huge problem that we have in this generation medically?
Hepatitis B. Hepatitis B. And as you know, the reason why HIV/AIDS, hepatitis B, these are two infectious diseases that are very, very prevalent all over the world. And it's simply because viral infections don't have any cure, as opposed to bacterial infections, sexually transmitted infections by bacteria. Antibiotics can knock them out, but viral infections don't have any cure. What medication does for people with viral infection is just to ameliorate the symptoms, bring it down, but it would take its normal course. And because of the fact that it's a lifelong thing, stigma is attached to it. Also, diabetes, some chronic diseases are a big problem, especially from the part of the world I come from. Many people are dying of diabetes, high blood pressure, okay? So these are all big, big problems that needs to be addressed.
Now, you're an educator.
Correct.
And one of the words we just used was misconceptions. There are a lot of myths and misconceptions when it comes to these very diseases you're talking about, diabetes, hepatitis,
Correct.
HIV. What is the one thing that you would want our viewers, those who are watching today, to know about their health? Something that they have one outlook, but it's not true. What is the most important thing to you that they should know about their health that's truth and not a myth?
We can all get sick. HIV, AIDS, any of these terrible global health issues can happen to anybody. And it is one area that you can't sit down and believe that you're immune to those diseases. As you help others, you learn a lot about the diseases, and you learn a lot how to take care of yourself to prevent those diseases. Most of these diseases are preventable. And we should all read between the lines and try and learn as much as we can of some of these diseases, because if you're thrown in the corridor of those diseases, you are going to get up and do something.
Someone who's watching in Nigeria or in Ghana or Kenya, some other country, even a Caribbean nation, where do they find hope right in their own land and in their own country?
Well, first and foremost, the fact that it's being discussed is a big bonus. Also, there's the tendency to emulate what obtains in the United States. And I'm hoping that as this issue of affordable healthcare is being discussed here in the United States and being actually implemented, that they will follow suit somewhere down the line. And some of us that are here and being part of all of these, this is part of the things we take back with us to Nigeria to see happen, and be your neighbor's keeper as well. Somebody is going through HIV/AIDS, for instance, be there for them, help them, and spread the word, and be an advocate to talk to others about prevention measures. So with that, yes, there's a silver lining, seriously, at the end of the tunnel.